Hello, ladies and gentlemen. My name is Dr. Kalitenko and I'm a medical doctor and I'm board certified in internal medicine. Today, we are going to talk about complementary cancer care. It all started many years ago. It started from a morning call and I just picked up the phone and the woman said, "Is this Dr. K?" I said, "Yes." And she said, "I regret to inform you, but your father passed away this morning." It was horrible. It's always horrible when you lose one of your parents. And I knew that actually it was the end of his suffering because he was suffering from a debilitating disease, he was in pain, and they were giving him pain medications, and he expired peacefully. Of course, I lost a parent, but at the same time, I knew that he's not suffering anymore because he was suffering before, and actually he died because of the prostate cancer. And as soon as I recuperated after that loss, I started thinking that now I have a problem with me because now I have a first-degree relative who died because of the prostate cancer. And obviously I am a male, I have my prostate, and I am at risk of prostate cancer. So I started thinking, what can I do about it to reduce my risk? And I went to my director of medicine, I'm a very good guy, excellent doctor, and I asked him, what do I need to do? And he said, don't worry, what you need to do is to take some supplements, vitamins, every day, and you will be fine. And I said, which supplements? And he said, take one pill of Centrum every day, Centrum vitamins. And I went to a pharmacy, I bought that Centrum vitamins, and I started taking one pill a day. And I thought I was covered. But a few months later, when I came to the hospital, I saw the picture of my director of medicine on the wall, and actually it was an invitation for his funeral. He died because of melanoma at age of 61. And I started thinking, he was telling me about Centrum, he was taking Centrum, but Centrum vitamins did not protect him from having cancer. So if he was not protected, obviously I was not protected as well. And I started thinking, what else can I do besides taking vitamins? So I started studying about cancer, about immune system. I learned about some fancy stuff like interleukin-1, interleukin-6, tumor necrosis factor, BRCA1, BRCA2, but it was too much complicated. It was so complicated I can't make sense out of it. So I called my mom and said, Mom, I need your help. What do I have to do? I need to protect myself. I'm a male. I don't want to die because of prostate cancer. And she said, son, I don't know anything about medicine. But what I know is that can you look for something simple? Always try to find something simple things you can just do right now that is just in front of you instead of looking something complicated. And I started thinking about my mother's advice, but I didn't know what can I do. And actually, it was a very interesting situation when a patient came to see me with ovarian cancer, and she said, the doctor, please help me. And I started thinking how I can help her, and I asked her ask her a very simple question. I asked her, what do you think? Why do you have cancer? And she said, well, I think that I have my cancer because I didn't sleep well. And I said, why didn't you sleep well? And she said, that's because I was working night shifts at the car service. Wow. She was a simple woman, just without any medical knowledge, but she just had a common sense. So she figured it out, that she had cancer because she was not sleeping enough, and that's why she had it. And it did make sense to me because, as you know, when we repair ourselves at night, from the time when growth hormone is secreted, when melatonin is secreted, just before midnight, and she was not sleeping at the time. She was working in the car service as a dispatcher. So it did make sense. So I was thinking that maybe it was something simple. People have cancer because they don't have enough sleep, or maybe something else that they don't have enough nutrients. Maybe they don't have enough um, enough vitamins, enough nutrients. Their digestive system maybe is not working. And then another patient came to see me, and he asked me a very simple question. He was suffering from disseminated lung cancer, and he asked me, "Doc, I know that you're specializing in finding the root cause. So I want you to figure out why I have cancer." And I said, "Why are you so interested in this question?" And he said that the reason why I'm asking you to do that is because all my family, they're fat, they eat junk food, they smoke, they drink, but none of them have cancer. I don't smoke, I don't drink, I eat the best diet in the world, and I have cancer, and they don't. So I want to know why. So I started investigating. His vitamins were good, not that much problems. Metabolism was not that bad. It was a lengthy process, but finally we did figure it out. He was lacking digestive enzymes. So there was no way he could digest food he was eating. So the solution was quite simple. To improve his well-being, obviously we needed to give him digestive enzymes. So I started realizing that sometimes, if not all the time, the reason, or at least very important factor of having cancer, maybe it's just in front of us, like lack of digestive enzymes, or maybe something else. And the other things I was thinking about as were toxins. And then another patient came to see me, and he was suffering from disseminated colon cancer, and he asked me the same question: why do I have cancer? And when we started testing him, we found out that his lead burden was off the roof. It was just almost beyond the level that the maximum level lab can detect. And lead is obviously a problem. It's linked to cancer, and obviously there is another problem because lead interferes with vitamin D metabolism, and as you know, vitamin D is crucial for cancer fight. And so it was just in front of us. This patient was loaded with toxins, and besides lead there were some other toxins. So what we started doing is to detoxify this patient to help him out. So that's why as soon as I learned these things, that I realized that sometimes cancer patients need something simple to fix, like lack of vitamins, vitamin D level. Say almost 100 patients, or 100% of patients who come to see me with cancer, they don't have optimal levels of vitamin D. And as you know, as per official recommendations, the normal level of vitamin D is from 30 to 100. But in my understanding, cancer patients should be on the top, should be having like 80 to 100. And as far as I remember, none of my cancer patients have this number when they came to my office. So vitamins, digestive system. You can eat the best food in the world, but if your digestive system is not working, forget it. You're not going to get nutrients. So we check digestive system, normalize the function of digestive system by diet, by giving prescriptional probiotics, prescriptional, not over the counter, prescriptional digestive enzymes. Of course, the patient needs it. If we are looking for bacterial overgrowth, parasites, etc., we look for yeast infection, other sources of infection, of course, toxins. So we not only look for the levels, we look for burden. That's the most important thing, is burden, it's not the level. And if you find that the burden is high, we detoxify the patient, and that's why the toxin level goes down, and his body starts working better and better and better as soon as his toxin levels go down. That's what we do as a complementary cancer care. So to summarize what I said, what we are looking for, something simple. Not sleeping enough. If somebody is not sleeping enough, we treat insomnia. Digestive system function. We find out the problem. The problem could be zillion. We fix it. we look for chronic source of inflammation. Could be sinusitis, chronic sinusitis, root canals, gluten problems, and toxins, of course, toxins. So we detoxify patients, and that's what we do to provide complementary cancer care. Thank you.